I got into medicine to care for patients, but so much of medicine, unfortunately, is almost like what I would call busy work. It's the documentation, it's the paperwork. I don't think that that's ever going to go away, but I think that with Suki, for example, we're going to change people's lives. People are going to go back to enjoying practicing medicine, because I think now the burden of sitting on your computer and documenting and doing forms and kind of all of this stuff that you never think about when you are a medical student or a resident that becomes a part of your daily life, I think that these things are going to get better and better and hopefully keep people in medicine. Before, where I felt very tied down to the computer, making sure that I got all of those details written down, I don't have to do that anymore. I can be at the bedside examining the child while the parent is discussing a particular problem. So I can be doing the focused exam that relates to their problem and getting the history at the same time, and it's being captured, and I don't need to worry about that. I think that part of being a primary care physician is those relationships you make, and you can't make those relationships when you're sitting staring at a computer. If I can have technology summarize what's happened over the last year since I've last seen the patient, what did their nephrologist say? What did their pulmonologist say? What did their cardiologist say? So that I don't have to go and dig and click and look for all of that, and it can be pieced in a nice summary for me, that saves a ton of time and mental energy. And again, when you're a primary care physician and you're really looking across the scope of all of the things that are happening with the patient, that's a lot, especially for a medically complex patient. And so when you can have something kind of do that summary for you, it's wonderful. Just removing that mental load and knowing that it's already been taken care of is huge.